you do whatever it takes to protect the lives of those you love. Currently, in the US alone, the COVID-19 pandemic has infected over 14 million people. Over 200,000 people have already died from this virus, and consequently, as a side effect of this is that many of us are out of work or unable to see our friends and family. COVID-19 is a very real problem, and it has affected all of our lives in definitely a negative way. So what if I told you that you can actively stop the spread of this virus and save the lives of those around you simply by wearing a face covering? For many of us, this is something that we've heard time and time again. But the act of wearing a face covering has been so politicized that some people believe that they do not need to wear one. And despite science and peer-reviewed research, many people still choose not to wear a mask. So I guess the point of this is just that I want to reiterate how crucial wearing a face covering can be, not only for ourselves, but for the people that we care about. Working in a hospital, I have direct contact with people who have contracted COVID-19 and who are suffering from it. Witnessing the detrimental effects of this virus has helped me to realize just how harmful COVID can be. I've even had many coworkers who've had it as well, and I've had it too. And since the beginning of 2020, the number of people infected has risen from 0 to 66 million globally. So according to the Center for Disease Control, there are over 14 million cases in the US, and I think we're reaching about 300,000 deaths. It's coming close. So unemployment rates have increased to 14.7%, which is the highest that they've ever been since the Great Depression. And many states, mass gatherings have been prohibited, which makes it difficult for us to hang out with our friends or to see our family. I know that I planned a trip to see my grandparents that I had to cancel because of this virus. And even as students, things are especially difficult because we've had to transition to almost a 100% online environment, and that has proven difficult in a lot of ways, not for just students, but for teachers as well. This virus is an unfortunate reality, as every one of us can attest to the fact that we have been a victim of it to some degree. So how does this relate to wearing a mask? COVID-19 is spread through droplets. When an infected person coughs, sneezes, or talks. And a good way to visualize this is when you go outside in cold weather, the fog that you breathe is actually all of your droplets. It'd be kind of an experiment for you to go outside and breathe out and then put on a mask and then do the same thing and see the difference. So masks are designed to help catch most or all of these droplets. And according to the Mayo Clinic, asking everyone to wear masks can help reduce the spread of the virus by people who have COVID and don't realize it as well. So now that we are aware of the fundamentals of how masks are supposed to work, we could see that when worn over the mouth and the nose, wearing face coverings can proves significant positive results. According to the Center for Disease Control Director, Dr. Robert Redfield, quote, "If all of us put on a face covering now for the next 4 to 6 weeks, we could drive this epidemic into the ground." That just kind of helps us to see the impact if every one of us started to wear face coverings when we went out. And also a meta-analysis done by the UC Davis Children's Hospital found that wearing a face covering, by wearing a face covering, the risk of an infection to the wearer is decreased by 65%. So, we can all see that a mask can greatly reduce the infection rates of COVID-19. And in conclusion, COVID-19 is a deadly virus, and it has affected all of our lives. So we can't say that it's not real, because it definitely has affected us negatively. And the only way that we can actually eradicate it is to follow the CDC recommended guidelines of washing your hands, wearing a mask, and social distancing. That's the only way that we could get rid of it until we have a vaccine, of course. And I just kind of want to remind us all that we're all in this together, and that we're all responsible for each other's safety. As a healthcare worker, on behalf of my patients and coworkers, I just ask all of you to just wear a mask and just think of the people who are suffering because of this virus. And that concludes my talk. Thanks. Do you have any questions?
So my audio cut out in this part, but one of the audience members made a very insightful comment that said, and she said that if everyone, even the essential workers, just stayed at home, then the coronavirus would be pretty much eradicated. And I thought that was a very interesting comment. But what I pretty much said it is that it doesn't necessarily have to be that way, and that there's a way for us to still go out and go to work and still do what we need to do to make a living while staying safe at the same time, and that it is possible for us to go to work and school and do those things as long as we're just staying safe, social distancing, and wearing masks.